I find very helpful for people to understand what are the mechanisms by which we develop blood pressure in our country. We don't know in great detail how exactly we develop high blood pressure and when we develop high blood pressure without an obvious cause, we call it primary hypertension. So that's the most common. The vast majority of patients develop blood pressure without like a narrowing of an artery in the kidney, or some very palpable. In that case, so the vast majority of us, 90%, 95% of everybody who develops high blood pressure, develop it because we eat too much salt, and we eat too much altogether. Big discussion, is it eating too much? Basically, then we eat too much salt because we're eating too much and because there's so much salt in our food, or is it eating too much is an independent mechanism? It appears that it is. It appears that eating too much salt, eating too much are two ways to lead to high blood pressure. And those two ways are ways that we could, that one can address. So we eat way too much salt, probably 4 or 5 times more than we would need. And the reason for that is salt. We were designed as individuals biologically to crave for salt. So if you were selling food, if you don't put salt in your food, you lose the competition with your competitor. So we end up with a lot of salt on everything, and there has been more conscience of that, but there needs to be even greater conscience that we need to basically lower the salt level on prepared foods. The other issue is basically the caloric intake. So we need to eat less also, because high body mass will lead to high blood pressure. If one addressed those two factors, that would be already an incredible. On top of this, physical activity appears to have a very beneficial effect over and above losing weight or eating less salt. So physical activity is quite important, and also diet, even beyond salt intake alone, is important. So eating more potassium from fruit is very important, and from a cardiovascular standpoint, eating more fish is also quite important. Societies that eat fish 3 or 4 times a week have a lower incidence of cardiovascular diseases. There's no question about it. But it is the issue. Well, we are not going to change our society overnight. That's unrealistic to think. The power of education cannot be underestimated, because smoking has declined significant in this country, particularly among men, because of education, because we took the glamour out of smoking, and particularly men don't smoke anymore. Young women are still smoking to control weight, but that's also something that needs to be